Welcome, and thank you for taking the time to watch this demonstration on meaningful use, and specifically how to achieve the core and menu measures with the MTBC EMR. The MTBC EMR, as you know, is an ONC ATCB certified software which supports meaningful use as a complete EHR. This series of video demonstrations will show you the details of meaningful use for all 25 meaningful use core and menu objectives. Now, as you might know, there are 15 core objectives for meaningful use and 10 menu or discretionary objectives for meaningful use. As a provider, as an eligible professional, you'll have to meet the 15 core requirements along with your choice of 5 from a menu of 10 available menu requirements. And the completion of those 15 core requirements and 5 menu requirements will mean that you are a meaningful user of an EHR, and you'll qualify for the $44,000 Medicare incentive or the $63,000 Medicaid incentive over the course of the next 5 years. So let's go ahead and take a look at what are the core and menu objectives for meaningful use, and you can follow up in detail for any of the meaningful use objectives that you wish using the videos on this webpage. Now, there are 15 core requirements for meaningful use, and they include things as computerized provider order entry for medication orders. These are simply electronic prescription entry. It does not mean necessarily the submission of those prescriptions to the pharmacies. However, there are core objectives that deal directly with electronic prescribing. This is simply provider order entry or the entry of medications into an electronic system. And the measure for this requirement is 30%, and that means 30% of the patients that are seen during your meaningful use reporting period. Additionally, core option number 2 is the implementation of drug-to-drug and drug-to-allergy checks, and this has to be enabled throughout the meaningful use reporting period. Number 3, maintain an up-to-date problem list of current and active diagnoses for 80% of the patients that are treated during the reporting period. Number 4, generate and transmit permissible prescriptions electronically. And for this measure, it's 40% of the prescriptions that are submitted during the reporting period must be sent electronically. And there's a minimum of 100 prescriptions that should be sent electronically. And we'll talk, of course, about if your practice does not submit that many prescriptions or how to track those total number of prescriptions. Number 5, maintain an active medication list for 80% of the patients. Number 6, maintain an active medication allergy list for 80% of the patients. Number 7, record the following demographics: language, gender, race, ethnicity, and date of birth for 50% of the patients. Number 8, record and chart changes in the following vital signs: height, weight, blood pressure, BMI, and growth charts for 50% of the patients. Number 9, record smoking status for patients ages 13 years and older, and again 50% of the patients. Number 10, report ambulatory clinical quality measures. And what this is specifically, if you recall, the PQRI program or the Physicians Quality Reporting Initiative program. And here in this scenario, it's simply to provide aggregate figures for the entire 90-day period, provide aggregate figures of your clinical measures. And we'll talk in detail about that in video number 10. Implement one clinical decision support rule relevant to your specialty or to a high clinical priority, along with the ability to track compliance with that rule. And here the measure to achieve this requirement is simply to implement one rule. And this could be any rule of your choosing that is in line with your specialty or something that you believe is a clinical priority for your patients. So the implementation of one rule during the 90-day period. Number 12, provide patients with an electronic copy of their health information. And for the patients who request this information, 50% of those requests should be handled within 3 business days. Number 13, provide clinical summaries for patients for each office visit, and this is 50% as well. Number 14, capability to exchange key clinical information, and this exchange should happen between providers of care or between authorized entities. So this exchange of information, clinical information, with either a health information exchange or other providers or provider groups or a hospital, and for this requirement it's simply one test during the 90-day period to achieve the capability to exchange key clinical information, and we'll talk about that in detail as well. Number 15, protect electronic health information created or maintained by the EHR. And here in this scenario, they're asking for you to complete one review or one audit of your EHR software. So these are the 15 core measures, and we'll talk about the individual measures as we continue on with these video demonstrations. And additionally, you can dig in, download the PDFs, download the individual help guides for each and every one of these core measures. So let's take a look at the menu measures now. For the menu measures, there are 10 menu measures, of which you will have to choose 5. The first one, number 1, implement drug formulary checks. And this should be enabled throughout your entire reporting period. And the drug formulary, for those that are not aware, is simply the software which allows you to see what are the least expensive medications for that patient-specific insurance or any special rules that that patient's insurance may have in accordance with that medication. Number 2, incorporate clinical lab test results. So this is an option that you have if you wish to achieve meaningful use through lab result integration, or if you're already integrating lab results into the MTBC EMR, then you're already meeting this requirement. And here the measure is 40% of your lab results should be incorporated as structured data into the EMR. And later on in that video number 2, we'll talk about the difference between structured data and non-structured data. Number 3, generate patient lists by specific condition to use for quality improvement, reduction of disparities, research, or outreach. And this is simply the measure here is to generate one report during your 90-day period to use for patient outreach or research or any of the other items that are applicable to this rule. And we'll talk about this rule in detail. But here, literally, we have to generate one list during that 90-day period. Menu item number 4, send patient reminders for preventative or follow-up care. And here the rule is interesting. 20% of patients who are 65 years or older or younger than 5 should have a reminder sent to them. So 20% of patients 65 years or older or under 5. Number 5, provide patients with timely electronic access to their health information. And here 10% of your patients need to be provided that information. Number 6, use certified EHR technology to identify patient-specific education resources. So provide patients with education material for 10% of your visits. Number 7, the eligible provider who receives a patient from another setting of care should perform medication reconciliation. And here 50% of the patients who are transitioned in care should have medication reconciliation performed. And we'll talk about what the definition of transition of care is in video number 7. Menu objective number 8, the eligible provider who transitioned their patient to another setting of care or another provider of care should provide a summary care record for each transition of care or referral. So providing a summary care record or a summary of the visit should happen for 50% of the patients. Number 9, capability to submit electronic data to immunization registries. And here this item again simply says complete one test. And number 10, capability to submit electronic syndrome surveillance data to public health agencies, and again the measure is one test. So these are the core and menu objectives, and the videos that follow will cover each individual point and how it can be achieved through the M2BC EMR.